ICD-10 CM Coding Guidelines, Chapter 9, Circulatory System, Introduction. This chapter is all on the circulatory system, so there are certain diseases that will always be coded. These won't ever be coded as included or the exclude to note states. My apologies. I will read this for you from the guideline book. An exclude to note. A type 2 exclude note represents not included here. An exclude to notes indicates that the condition excluded is not part of the condition represented by these codes. These exclude to are not represented in the I codes. But a patient may have both conditions at the same time. Of course they could. They could have a complication of pregnancy and a heart condition. When an exclude to note appears under a code, it is acceptable to use both the code and the exclude code together when appropriate. So exclude to for the circulatory system, it's conditions in the perinatal period, certain infections and parasitic diseases, complications of pregnancy, childbirth, and the puerperium, congenital malformations, deformations, and chromosomal abnormalities, endocrine, nutritional, and metabolic diseases, injury, poisoning, and certain other consequences of external causes, neoplasms, symptoms, signs, and abnormal clinical and laboratory findings not elsewhere classified, systemic connective tissue disorders, and transient cerebral ischemic attacks and related syndromes. And you can see these ranges of codes. You don't have to memorize this. The encoder has all of this in here. This is just an overview, so you kind of get to thinking about what the excludes to are for Chapter 9. Chapter 9 contains the following blocks of codes. We have I00 to I02 is acute rheumatic fever. I05 to I09 is chronic rheumatic heart disease. I10 to I16 is hypertensive diseases. I20 to I21 is ischemic heart diseases. I26 to I28, pulmonary heart diseases and diseases of pulmonary circulation. I30 to I52, other forms of heart disease. I60 to I69, cerebral vascular disease. I70 to I79, diseases of arteries, arterioles, and capillaries. I80 to I89, diseases of veins, lymphatic vessels, and lymph nodes not elsewhere classified. I95 to I99, other and unspecified disorders of the circulatory system. The guidelines are in 5 sections, A through E. A is the biggest section of guidelines. It's all the hypertension. There are 11 guidelines here, and there are a lot of guidelines regarding combination codes between hypertension, kidney disease, and heart disease. Remember those 3. The Section B guideline is just one about atherosclerosis, sclerotic, coronary artery disease, and angina. C is intraoperative and post-procedural cerebrovascular accident. There's one guideline about that. D is sequelae of cerebrovascular disease. 3 guidelines there. And acute myocardial infarction, that's Section E. That is 5 guidelines. And that is the introduction to Chapter 9. Let's get started.